So this video is about receding gums and what you can do to fix them. Most people end up with recession problems somewhere in their mid to late 40s, and as they get older, they usually get worse. Gum recession is damage. It is a physical damage of some kind. Usually, if you can take away the offending problem, recession then can heal very quickly. Your gums will get healthier, and then your gums will begin to regrow. If you keep doing the wrong things, it will simply get worse or it won't get better. So this video is about receding gums and what you can do to fix them. Now, you may be thinking that you don't have receding gums. Maybe you've never been told about your gum health. If you are 30 years old, be aware you may already have problems starting, particularly if you've done anything like whitening your teeth using baking soda or peroxide, or if at some point your gums were bleeding. So hang with me here and let me explain how receding gums occur and how you can prevent that from happening to you and becoming a real problem. And also, if you have receding gums, what are your options? What can you do? Well, you can ignore it. Again, if you don't know you have gum recession, you can just turn off this video or listen and realize that prevention is adopting the plan for reversing the problem before it starts. That's basically what prevention is. Taking the steps that keep your gums healthy, and if you already have recession, then using these steps that I'm going to give you to try to reverse the problems. If you do nothing, most people end up with recession problems somewhere in their mid to late 40s, and as they get older, they usually get worse. And the result of leaving it is that your teeth will feel sensitive, they'll be more prone to decay around the edges of them, and this is where you end up needing either a crown or something that's bigger than a filling, or a very difficult filling, or worse yet, that you need to have a root canal or have the tooth extracted. So recession isn't something you can really just ignore. The treatment offered today for recession is sort of a kind of Botox, which puffs up your gums and makes it look better, but it really doesn't deal with the underlying causes. You can have grafting, which is kind of like plastic surgery. Again, if you still got the problem in your mouth, why would you do this? You go through all the pain and suffering of grafting, maybe skin from the roof of your mouth to go over the sides of your front teeth. But the problem is, if you don't figure out why you have recession, which is what I'm going to talk about, it's simply going to come back. You'll pay your money. It's usually quite expensive. You'll go through the pain and suffering. Can be quite nasty too. And then 5, 10, 15 years later, you will definitely be readdressing the same problem. And after you've done grafting or this kind of pinhole, as they call it, or puffing up the gums surgery, usually you'll be in a worse state 15 years from now. So I recommend that everybody considers how you can work to reverse recession, whether or not you've even been told you have recession. So were you told you couldn't reverse your gum recession? Many people are told this, and I'm going to try and explain to you why you can reverse gum recession with the right strategies. I suggest, like I always suggest with everything, why don't you use the interval between this moment and your next dental appointment to see what you can do. Just give this a try. Maybe it's only a month or 2 months or 3 months. But I want to tell you one thing. If you find your mouth health is going in a new direction, that your teeth feel smoother, your gums feel better, just keep going and you will see improvements. Many people have been told they caused the gum recession with poor toothbrushing, or they brush the enamel of their teeth too hard. First of all, healthy tooth enamel doesn't wear away. Healthy tooth enamel is harder than steel. It has a Mohs pH hardness of 5. You can look that up. You can Google search. And steel, you will find, metal, has a Mohs hardness number of 4.5. If you have a toothbrush, it's not going to wear your teeth away if your enamel is hard, is healthy, is how it's supposed to be. I'm not calling your dentist a liar. I'm just saying that most dentists see patients whose enamel is not healthy. And that is because most patients do not know they need to mouth rest after eating. They don't use xylitol, and they don't use my complete mouth care system or the products that I recommend that bring your enamel into its peak hardness. When your enamel is hard, you will be able to brush your teeth and your gums, which we're going to talk about in a minute, with enthusiasm, with vigor, and effectively, and do gum massage and everything in your mouth that will help your gums to recover and regrow. But you have to get your enamel healthy first. And in order to do that, you have to understand that acidity always softens your teeth. So if you're sipping and snacking all day, whether it's on sparkling water, soda, coffee, tea, particularly anything that has a citrus factor, if it's got a little bit of lemon, you're going to soften your teeth. You're literally pulling the minerals out of your teeth and leaving them vulnerable to being worn away. So yes, your dentist is right in one respect. If you have unhealthy enamel, you have the potential to wear it away by brushing. He will then recommend to you, or she will recommend to you, a soft toothbrush. When you have a soft toothbrush, you're not going to be able to do gum massage. And if you can't do gum massage and massage your gums, get the circulation, the lymphatic drainage, the movement we need in your gums, you're going to get gum recession that isn't going to be reversible. You must get your enamel healthy by mouth resting and by using good products, and the products I recommend in my complete mouth care system would be my recommendation. Once you have looked after your tooth enamel, you are going to be able to use a better toothbrush. And I recommend a flossing toothbrush that is quite resilient. And I do this because you're going to need to massage your gums with it. So taking that aside, we have now opened the door to the possibility of you being able to do gum massage, correct mouth care, mouth resting, which is when you eat and drink and then have a period of time after your meal where you do not eat or drink, and you're using xylitol, especially after meals, before this mouth resting period, so that your saliva is full of minerals and immune cells, and xylitol feeds the good bacteria in your mouth so that it helps your gums to regrow. All right, so that is one strategy that you have to get your head around that is different from what you've been told. The second part of this, if you're trying to reverse gum recession, is that it all depends on the health of the gums between your teeth. And for this, I'm going to show you a little analogy. If you have a necklace and you want to raise it up at its lowest level, you can't push it up. And your gums are the same. I have people trying to massage their gums up. It's not going to work. You get your bottom curvature of your gums, the part that's receded too low, to come up by actually pulling on the sides. Raising the side up will bring your gum level up. So I hope that helps you understand that it is the gum tissue between the teeth that is so important and so vulnerable and so valuable, vulnerable and valuable for regrowth of the receded part that's at the bottom of the curve. So we're looking at massaging the gums between the teeth and all around. And that does go actually below the curvature part and on it everywhere. I want you to be able to brush everywhere. One of the reasons I tell you this is that if you are an avid flosser and you're jamming the floss in and out between your teeth, you will be beating down this tissue between your teeth. And a lot of women end up with gum recession. They don't understand it. They do more flossing, and the gum recession will simply keep getting worse. I tell those women, men too, if they're doing it, but it's usually the women who are so compliant, stop flossing. Let's use liquids. If you're using my complete mouth care system, the liquids are going to be swished in and out between your teeth, and that will do the flossing without any risk of causing these high points between your teeth to get beaten down. So if your gums bleed, if you're worried and you're flossing because you've been told that your gums bleed and you need to floss more, I am still going to tell you, in my opinion, you will have more success by retiring the floss. And I'll tell you here, I haven't flossed a day in my life. I use flossing toothbrush bristles to remove food, to clean around, and mostly to do this gum massage that is so important for the health of your gums. If your gums are bleeding, you need to stimulate a healing response inside the gum tissue. Imagine you grazed your knee. You don't run for a length of string to rub over your knee. Your body actually calls for stem cells and blood vessels to grow and heal the wound and regrow the skin. And that's what the gum massage does. It stimulates a healing response in the gum tissues. It actually calls for new blood vessels to grow to that area that you're vibrating with the toothbrush, and new blood vessels and new cells will come there. Now, some people are scared to brush because they've been told they wore their gums away. I would say to those people, give me one other place on your body where you brush it or rub it a little more and it becomes thinner. As far as I know, when I do gardening things and I rub my hands more, it develops calluses. When I write and my pen rubs against my finger, I don't see the bones through my finger, I see a fatter piece of skin. The bottom of your feet, we rub on them all day long. What do? They get thicker. So this idea that because you brush, your gums get thinner, in my opinion, is completely flawed. And I pay no attention to it. I teach gum massage, and people have seen spectacular results. I know you've been told to floss because if your gums bleed, you need to toughen them up. I would suggest that the PFAS chemicals in floss, the trauma simply by beating your gums with it, does not help. Water flossing, I prefer to use rinses because you have so much more control, and it's going to go everywhere in your mouth in a better way without the pressures and the pressure points that sometimes water flossers put in the wrong place. Our goal is to grow this tissue back up between the teeth. And one of the ways that helps is, again, I'm going to go back to the idea of xylitol, because xylitol, in addition to all the other great things it does, like stimulating a flow of saliva and feeding good bacteria, it actually also makes plaque less adhesive, so you don't get it stuck by your gums. And the other reason gums bleed, usually, if it's not because they're not healing well enough, it's because they got plaque stuck on them. And if you're using the adequate amount of xylitol, that plaque will go away. You don't need floss to make it go away. It will be eliminated. I have 0 plaque-forming bacteria in my mouth. So you can get there too. It requires a little bit of xylitol at the end of every eating and drinking period, followed by mouth resting. And if you can do that 4 or 5 times a day, you will end up with no plaque very quickly. Your gums will get healthier, and then your gums will begin to regrow. Now, that said, I also have to warn you that you need to find out, like any forensic investigation, why do you have gum recession? So possibly the most important thing for anyone with gum recession who's been told they've got gum recession or thinks they've got gum recession is to figure out why. You have to do a forensic look at why this has occurred. You either had a very acidic mouth, or you overflossed and beat the caul, the tissue between your teeth, down, and that caused your gums to go down. It can be chemical. Maybe you're whitening your teeth with peroxide, or baking soda is another thing that strips your teeth of its protection and can leave your gums in danger. So if you have been using a baking soda toothpaste, peroxide, whitening, if you've been using a lot of acidity in your mouth for some reason, some people rinse with cider vinegar. They're told that's healthy. It can cause dreadful gum recession. I mean, really bad, aggressive gum recession. Heavy deposits of plaque because you were a snacker, a sipper, you never rested your mouth all day long. These are all reasons for gum recession. And they're easy because all of those things can be changed. You can stop doing them right now. If you've been going for dental cleanings every 2 or 3 months, thinking it was a healthy thing to do, too many cleanings, good for the dentist's pocketbook, but I believe it strips away the healthy biofilm, and there are much gentler, safer ways to keep your teeth clean and healthy with the right kind of mouth care routines. I would suggest you look into my complete mouth care system. So now this brings us to the really tricky place. What if none of those things ring a bell? Maybe you're using my complete mouth care system. Maybe you mouth rest very well every day. Your nutrition is good, your health is good, but you have this recession. And maybe you're young, maybe you're old, it doesn't matter. Why is it happening? The next place I look is your nasal health. Do you have sinus problems? Do you have allergies? Are you taking medications? Medications for the allergies or the sinus? Because if it's drying up your mouth, if it's drying up your saliva, you're not getting those salivary benefits. So look into that. Saliva also dries up if you've been started to take blood pressure pills. Sometimes it's something like that, or antidepressants. So try and see when this started. Try and see if you could identify a medication you began at that time, or, as I say, a sinus issue or an accident where your nose was broken, or there are usually some indications of why. You can correct that in any way. Talk to your doctor about the medications that are drying your mouth. See what else you can do. Use more xylitol. Those would be ways around it. Now, dry mouth can occur, you may not even be aware, if you move to an arid, dry climate. Maybe you're living in the desert now and you used to live in Seattle, Washington. That can cause a change in your mouth health. You may need to have some sort of humidifier in your room at night, especially if you breathe through your mouth, if you sleep with your mouth open, or at that time of night where your saliva is at its worst. So those are things to think about straight away. Breathing through your mouth doesn't necessarily create a problem. If you're using my complete mouth care system, it's usually adequate to give your mouth enough protection. If you're not, if you're using some fancy $25 toothpaste that's good for teeth and not for gums, be careful, because there are ingredients in some of these toothpastes that are good for teeth and bad for your gums. Arginine is one in particular that I think you should be very careful of, along with baking soda and anything with peroxide. So that said, I recommend a complete mouth care system that I'm comfortable with. If you live in a country without the complete mouth care system, my next best choice would be a Miss Wax stick. I love them. I think they're great. We're at a point now where we've gone through a lot of things and it still doesn't ring a bell with you. My next question to you would be, did you have orthodontics done in the past? Do you wear a retainer? Are you using a night guard? Did you start Invisalign? In other words, did you recently mess with your occlusion? And I think we can add into that now because the materials that people are using for implants and crowns are so hard today. They are rock hard. And if you have a new implant, it could have affected your bite. And if you've had orthodontic work done, it may have affected the way your teeth bite together. And it is that crunching on a tooth that can cause the damage. You see, a really important thing to remember, if you remember nothing else, remember this. Gum recession is not a disease. Cavities are a disease. Periodontal disease, gingivitis, they are diseases, bacteria. They can be cured by getting rid of the disease. Gum recession is damage. It is a physical damage of some kind. And this damage has been done by chemicals. It can be damage from chemicals produced by bacteria, but it is damage. And this damage can be caused by a bad bite. And I would encourage you, if you've explored all these other options that we've looked at today, to go and try and find a dentist who knows something about biting. It's called occlusion. And one of the most respected dentists in dentistry did a podcast this week lamenting the fact that today dentists don't understand occlusion and the vital importance of how your teeth bite together. So try and find a dentist who's experienced. Try and find an orthodontist who has years of experience. Ask them. Prosthodontists are dentists who have particular expertise in occlusion. Usually they know about this. So if you are able to get to a hospital, a teaching hospital, a dental hospital that has a prosthodontic department, that might be a way to go there and ask them if they see anything about your occlusion that could be causing the recession. Of course, you would expect that your gum specialists, your periodontists, would be the people to go to, but I'm not sure how much occlusal knowledge is being taught to periodontists. I hope it is. But I want you at least to know that there are these different specialties in dentistry and learn the difference. And if you're getting gum recession that's not getting cured, not reversing, before you have surgeries or lose teeth or just give up, see somebody who knows about how your teeth bite together. And I'm hoping that in the future, this will be perhaps a specialty of its own. And finally, if you find you grind your teeth or you find yourself biting on a particular tooth at night, it could be something to do with your airway. So see a sleep specialist or an airway specialist and just make sure that you don't have a restricted airway, because sometimes grinding your teeth is a signal that you actually have airway obstruction and your body is basically trying to wake you up to do something about it. So that's another avenue to explore along with all these others. But usually, if you can take away the offending problem, whether it's flossing, bleaching, snacking and sipping, bad mouth care products, or something wrong with your occlusion, and by taking it away, I don't mean get a night guard. I mean figure out what is the problem. Maybe it's taking out the night guard and letting your teeth just find their way back to where they want to bite. But recession then can heal. So I'm sure there are some of you out there with questions. It's a very worrisome topic, especially if you're in the middle of it and you're fighting with it, and if you're young. I had a gentleman the other day, 39 years old, and his back teeth don't bite together. And he's been working to try and get his gums to regrow, but they won't regrow if his teeth don't bite properly. So if you have questions, please leave them below. Ask for help. So I will do whatever I can to try in video form or answering your questions below to help you figure this out and figure out for yourself how you can reverse the problems. But don't forget, it may be quicker and easier for you to go and have somebody look at the way your teeth bite together. If you suspect that you had a tooth taken out or you had things done when you were younger, that this is the reason, go see an orthodontist. Go and get an evaluation. There's an academy called the Dawson Academy, and they specialize in occlusion. You may want to try and find a Dawson Academy graduate as a dentist who has studied occlusion to look at your mouth. These are some of the best suggestions I have right now, beyond maybe finding an airway specialist, a dentist who is an airway specialist. That would be another way to go because they could also look at your occlusion. So if you're ready to start to get rid of these problems and change your mouth health, get started today. They're very simple. 3 very simple things will help you a lot, and you'll find them all in the next video on biohacking dental problems.